Hey George,
Hey, what's going on, Erin? How you doing?
I'm doing well, thanks. How are you?
I'm doing good, but I'm like a little anxious about today's podcast, to be honest. I'm very excited. Today we're gonna be discussing, anxiety, panic attacks, and just a lot of distinctions and definitions, and things to highlight and what to look out for. So I'm gonna ask a lot of questions today because it's a topic that does interest me, and you have a great clinical background. So like I know, we're discussing anxiety and panic attacks, and for myself personally, I always felt like they were one and the same. I've never done too much
Mm,
extensive research, and I kind of categorize them in the same area. But as a clinician, can you tell me like what are some differences between panic attacks and dealing with anxiety?
sure. Well, panic attack, I guess, kind of falls under the umbrella of anxiety. So I think when people think of anxiety, there's a few different things that people could think of. One would be a panic attack. That's kind of a subcategory. Some people have social anxiety, which is also like a subcategory. Um, with the DSM, which is the Diagnostic Manual for Psychiatric Illness, I think in the most recent one they had separated out OCD, but obsessive compulsive disorder used to also fall under an anxiety category, or maybe it still does. I'd have to check. But so there's different ways that anxiety can manifest, and then of course there's generalized anxiety, which many people wind up being diagnosed with because it's kind of like the broad sweep of anxiety. So what I thought I would do maybe is just give you the DSM definition of panic and anxieties, just so people can. I guess not everybody has a DSM handy like I do. Sometimes I take that for granted. So let me just share with you, for instance, the definition for panic disorder. And people, I think one thing before I even just read this definition. When I'm working with patients, there is a distinction between like an anxiety, like people say an anxiety attack or a panic attack, and those terms are used together. And an anxiety attack is not like a technical diagnosis, but as I get into what a panic attack is, it's very specific. And I think sometimes people have panic like symptoms, but they maybe last for a long time, or they're not quite as severe as a panic attacks. And that would just be an exacerbation of anxiety symptoms. So let me just tell you what the panic disorder definition is. So I guess even before I get into that. So, panic attack falls under the diagnosis of panic disorder. So, there's a differentiation there. And I'm remembering that just because this very first definition of recurrent unexpected panic attacks falls under panic disorder. A panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, during which time four or more of the following symptoms occur. So I'll read those off to you. So one is palpitations or pounding heart, accelerated heart rate. So your heart's beating through your chest. And so sometimes in anxiety, you feel that too. So I see how this can be a little bit confusing. But let's just envision that it's four or more of these symptoms put together at one moment. So the pounding heart, sweating, trembling or shaking, sensation of shortness of breath or smothering, feelings of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, chills or heat sensation, numbness or tingling, feeling derealization, so it's feeling of unreality or depersonalization attached from yourself. Um, that's kind of a tough symptom to describe, but it's similar to like an out of body type of experience. Like you just feel disconnected from yourself. You kind of feel like you're watching yourself. Um, And in very severe circumstances, a person kind of becomes a little dazed, like they're not quite in touch with what's going on around them in the moment. Fear of losing control or going crazy, and fear of dying. So, one thing I'll say with a panic disorder or panic attack is that people often feel like they're dying. It's rooted in a fear that they're dying, Um, and for that reason, people often feel like they're having or think they're having a heart attack. So a lot of times people wind up in the ER thinking they have a heart attack, and then they run all the tests and there's no evidence of a heart attack, but in fact it's panic, especially considering the numbing sensation. So people can get tingling in their arms, in their hands. And so particularly if they feel it on the left side, they're like, oh my God, I'm dying. And they're not, but they're having a panic attack, which is extremely uncomfortable. Um, so the other thing I will add is another part to the definition. At least one of the panic attacks has been followed by 1 month or more of one or both of the following. So after you have a panic attack, this comes: persistent concern or worry about additional panic attacks or their consequences. Um, that's a pretty important symptom because usually it goes together. So you've had a panic attack and you're now fearing a subsequent panic attack. Um, and the second criteria is a significant maladaptive change in behavior related to the panic attacks. So this means like behaviors designed to avoid having a panic attack. So you're avoiding an elevator, you're avoiding driving, you're avoiding social situations. So you're starting to avoid. Um, so it's a very specific, like I had mentioned earlier, um, set of symptoms that a person experiences when they're having a panic attack, and the other key is the fear of having another one, which is poor things, it's following them around day to day. And then so I'll just give you the definition. It's a little shorter, I guess I would say, of generalized anxiety to give you an idea of the difference. And maybe, I mean, this is all clinical, right? So after I read this, you can maybe, if you had questions or something, you can ask. um, so there's a few criteria. So first is an excessive anxiety or worry, or like apprehension, feeling apprehensious, occurring more days than not for at least 6 months, about a number of events or activities such as work or school, etc. The individual finds it difficult to control the worry. So we're often, yeah, the excessive worry. The anxiety or worry is associated with three or more of the following six symptoms. Um, so you feel restless or keyed up or on edge, being easily fatigued, so often feeling tired, difficulty concentrating or mind going blank, some crossover with ADHD there, irritability, muscle tension, and sleep disturbance, so trouble falling or staying asleep, or waking up not feeling rested, so some type of disturbance in the sleep. Um, and then it goes on to say basically that, these symptoms can't be attributed to something else going on. And so there's a general, it's called generalized anxiety disorder, but you can see how it's more like the broad stroke. So you have this anxiety and worry, and it affects you in the following kind of blanket ways. You have this general feeling of restlessness, you're easily tired. It's not related to a specific thing. You're not able to concentrate on things, irritable, lashing out, tense, and your sleep is disrupted. So and you only need three of those of the six. So um, I think it's easier to be diagnosed with generalized anxiety for that reason, and I'd say it's not an uncommon thing that people deal with.
Got it. So you're saying for the most part, kind of just generalizing. So panic attacks is in the anxiety umbrella. However, to be diagnosed with a panic attack, let's say you would have to exhibit multiple symptoms of anxiety in a reoccurring kind of time frame. Is that kind of the idea of the difference?
Yeah, the panic, it's like very pointed, right? So it's like I'm suddenly experiencing all of these symptoms at once. And I think one of the keys is that sense of, I think the old DSM would say the sense of impending doom, like something like I'm going to die, something terrible is happening. And it's all like this escalation. So you're suddenly breathing fast, or you feel like you can't breathe, your heart's pounding through your chest. You feel like you're going to die. You're having this tingling sensation. It's all very intense, and it's like at one moment. And then anxiety kind of like ebbs and flows over the course of the day, but it's kind of affecting you around the clock. So it's affecting you at work, it's affecting you at home, it's affecting you at night. Um, I would say that is the biggest difference between the two.
And just in your experiences dealing with patients and your studies, do you feel that people are maybe certain people are genetically predisposed to experience more panic attacks, anxiety attacks in their lives? Like, is there anything physiologically going on in the body, or does a lot of that come from their upbringing, things that have gone on in their lives, the way they were nurtured, etc. Or is it like a mixture of both?
Yeah, the nature nurture question. I would say from what we know, it's a mixture of both. In psychology, psychiatry, it typically is. We know some of the biochemical markers involved with anxiety. So serotonin, norepinephrine, GABA. We're trying to target some of these pathways with medication. And so the assumption is that this could be genetic. And you catch that through a family history. So, you see parents, siblings with anxiety or panic, you can kind of tell, or even grandparents, aunts, and uncles, okay, there's something in the family. Now, uh, yeah, because we have a biochemical component that we're aware of and we treat medically, you can assume it's in the DNA. But also, the psychological component is huge. So we think about like intergenerational trauma. So like trauma passed down through the family where certain mm, like core beliefs or mentalities, ways of treating each other that maybe were rooted in a traumatic experience from a previous generation that kind of comes down. Um, so that could also perpetuate a tendency towards anxiety or another condition. So the part that kind of clues us into there being a genetic component is that, so for some families you'll see the anxiety running through. For some families you'll see more bipolar disorder or like schizophrenic or depression tendencies. So how that stress manifests, we have to assume is has a genetic component to it. Um, and I think we also assume that people have different predispositions, which means like their body chemistry is likely to go a certain way, and then stress could trigger that. So again, that's like getting into the nuances of it because we can't quite know for sure. And I tell patients this, like, we can't study, I mean, we study the brain, but we can't like open up someone's head and test their biochemistry the way we can do like blood work or something like that. I mean, and they are doing it, and they're doing it more and more and more. But there's a little more guesswork involved in at least the prescribing side. So I would say it's a healthy mixture of both.
Yeah, no, I mean, I could imagine it's like difficult to pinpoint, but yeah, there's like a lot of advances being done with technology. So hopefully in the future, these are things that are more easily identifiable, and we'll be able to pinpoint, certain things that can help. Also what I'm getting from your description, it just seems like it must be really difficult to be experiencing like anxiety often and panic attacks, because just from my perspective, it seems like a snowballing effect, like
Hmm.
keeps getting worse and worse, and then if you can't get a handle on it, I'm sure it could really negatively affect your life, quality of life, etc. Like, what are some tips besides, like, obviously, we do medication as well, we do a lot of blood work, lab work, etc. But before we get to that point, are there any suggestions or tips you give to patients or loved ones in general on how to deal with anxiety or panic attacks?
Hmm. Well, it depends on the severity of a person's symptom, but I think when you ask that question, what I jump to is experiencing relief is important. So, like you said, that it can be a snowball effect, and I think that's very true because one thing about anxiety is that it's very convincing. Anxiety likes to act like it's fact, so it can feel very difficult to escape from. So, depending on a person, how they're tolerating the anxiety when they meet me, especially because I can prescribe, I will sometimes for more severe anxiety or even anxiety flare ups where I've been seeing somebody for a while and something's happening and they just cannot shake the anxiety that they're feeling, I'll prescribe a medication that can help more in the moment with the anxiety. And I'll say, okay, take this around the clock for like 3 or 4 days just to give your body a rest. And then I've just noticed there's a psychological benefit to that. If you know you can get relief if you needed to, then it helps you feel like, okay, I can get through this moment. If you, because the anxiety is so convincing, if you don't know when or how this will end, then it compounds the whole thing and it just keeps going and going and going and going. So that's one thing. If it's a non-medication situation, then we look at. I mean, still thinking about the body. So how are you eating? How are you exercising? How are you sleeping? So I guess there is, a big biological component, even when it's not around medication. Just taking care of oneself can help the body fight off anxious feelings. And then of course like talk therapy, and like having a good social support, all of these things are super important.
Yeah, and I'm curious. I actually came across a TikTok the other day. I love TikTok. It's awesome. But it was a TikTok, and the gentleman was describing anxiety. Speaking about anxiety, and then was kind of referencing that, hey, anxiety is not always a bad thing, and not necessarily a bad thing. That there are certain, maybe tricks you can try to put in your head to use the anxiety for positive situations. I was trying to grasp the concept of it, and it does, some of it does sound like appropriate, but what are your thoughts on that as a clinician? Is there any sort of good anxiety, and can it possibly be used for good at any situation?
Yeah, that's I really like that question. One, because the very first thing I want to do is differentiate anxiety from stress. So stress is something we all experience, right? So there's good stress and there's negative stress, I'll say. So I think in response to this thing you saw on TikTok, I would say let's replace the word anxiety with stress, because my experience is that anxiety can make a person be very productive. So for some, it's quite debilitating, and for others, it's nonstop. They're just working, 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 working. Especially in New York. So I see a lot of patients based out of New York, and the culture is work 24/7. Um, so, as a clinician, I think I would say, no, anxiety is like a clinical diagnosis, and anxiety is when the stress has gotten to a point that it's not controlled well. So, you're now experiencing the disruption that we just spoke about. You're either having panic attacks, or you're having generalized anxiety where you're not sleeping well, you can't relax, you can't focus, you're snapping at people, irritated. No. To me, that is not a functional state. And I think there can be some confusion, to your point, where a person feels productive because they're going to work, they're almost compulsively completing work, they're going to the gym, they're going home, they're seeing their friends, they're squeezing it all in because the anxiety is driving them. And if they were to stop, they're actually afraid of stopping because they're afraid of how they'll feel. And then that's oftentimes people that I work with who have that type of anxiety. It usually comes up at night in their sleep. So they function, quote unquote, in the daytime, and then they have a lot of trouble sleeping because it's the time where they have to be quiet. Um, and so I think that's the key to that answer, is that stress is normal, and stress can come. Yeah, there can be good stress. Like, I have this deadline, we have this group project, we gotta do it. And maybe sometimes there's excitement mixed in there. And I've heard people kind of flip like excitement and anxiety. So sometimes maybe you're feeling a little anxious, or having some stress, but it's like kind of mixed with an excited energy. So again, I kind of put that more into a stress category. If it bridges over to anxiety where it's affecting your life, then it's not. At some point, you'll either burn out, or have a breakdown or something. So I would want a person to address that.
Got it, got it. And do you notice breakdowns happen? Let's say, I don't know if that's the technical term, like breakdown. When you're just overexhausted, you've really hit the edge and you kind of just explode and pop. Is that
Mhm.
something that happens often with people that deal with high levels of anxiety?
I think it can come out in different ways. I think for some people it'll result in a big emotional for some it'll manifest in a big emotional outburst. For others, it might result in shutting down, like they're sleeping for 2 days or whatever. Now we're bridging into bipolar, but let's just focus on anxiety. Yes. Um, and then for others, it'll start to manifest in their body. So their physical health, maybe their blood pressure is going up. Um, and that's a big one, like cardiac health. The body actually starts to exhibit signs of wear and tear and chronic stress, which is why when I am prescribing and people will ask, like, especially for SSRIs and antidepressants to treat anxiety, they're like, "Hey, can I stay on this for a long time? What will happen?" And everything that I see is like, well, if we can protect the body's other systems by reducing chronic stress, which is a contributor to so many chronic illnesses, um, then that's better. So I think it kind of comes out in those three different ways: either an emotional explosion, uh, burnout, or just physical illness.
So I have a question for you, right? I have like a bit of a toxic trait, I would say, where people that I don't know too well, I'm very like understanding, very like, try to cater and try to see what can be done to help. And then when there's people closer to me, right, I feel like I'm a little bit more rough with them in regards to if I ever have any advice given. So in general, like, I have people I don't know too well and they're dealing with certain things and they ever, want to talk to me. I'm very like understanding and try to, give them like breathing tips or, just read a little bit, try to de-stress, which I know is not just, that's not where it ends. Like, we have to do many more things to deal with it, right? But if I have like closer people to me that are like dealing with anxiety and stuff, and I know it's toxic, but sometimes I'll just like say, suck it up, like, come on. And I know that that's not correct, but it's a toxic trait I have where the people closest to me, I kind of address them in that way, even though I know that it's deeper than that, right? So, like, how should I, if I have loved ones, people really close to me dealing with certain panic attacks, escalated levels of anxiety, like, what are ways for me to talk to them, approach them when they're giving me their problems or discussing their issues? Like, what are some things that I should do as a listener?
A couple of things I think of. One is looking at your own reaction to the person. So if you feel irritated by somebody else's emotions, then it just is like a kind of a basic therapy concept is we want to look at, like, okay, so how do you feel about their anxiety? So maybe it triggers anxiety in you, or maybe it bothers you to see them that way. Like maybe it's actually kind of sad or you're worried. Excuse me. Um, and so that can be helpful just to understand, like, okay, taking stock, like, this is uncomfortable for me. And so, like, I want to fix it, or I want it to stop, or I'm going to say something, um, you know, blunt to them. Um, and then the other thing to take stock of too is the types of people that you're around often. So, like you're saying, people closer to you and things like that. Sometimes we have to explore, maybe we need to set a boundary, depending on what that person's willingness is to take a responsibility for their own feelings and their own behavior. So it's a little bit of both. So sometimes, we have people in our life who they don't want to take responsibility for their panic. They don't want to take responsibility for their irritability. They don't want to do that. So they might have a breakdown, so to speak, or in a very highly emotional situation, and they call everybody they know, they dump on them all of their emotions, and then they don't really do anything to change that pattern, and then they go back to their life. And so if you find yourself in a situation where people are kind of taking things out on you, then it might be worth saying, okay, how often do I pick up the phone for that person? Because then I feel a certain type of way and I behave a certain type of way in response. Um, but also on the flip side, that we want to find the compassion. So acknowledging it's somebody that is maybe more open to talking with you and is genuinely asking you for help. Then it's more about sitting with, like, what is the discomfort that I have that this person feels that way? How can I maybe handle that separately and just be there for this person so that they can share with me what they're going through, and knowing my limit. And I guess that's another thing I'll add is, at what point are we as friends, not clinicians? So maybe there's a little helplessness sometimes too of like, well, I love this person, but I can't fix this. Like, I don't know how to fix this. Um, and I feel very helpless when they're saying all these things to me. And then it might be a conversation about that. Like, I love you. I care about you so much. And this sounds really challenging for you. And I actually, I don't feel like I can help you get past this. And I think maybe it's important to talk with somebody who can help you move past it. And I'm here to support you, and I'm here to like help you along your journey, but I don't know how to actually fix that. So I guess it depends on what it feels like for you and maybe it'll vary person to person, what the right approach will be.
Yeah, no, I think that was just very helpful. First reflect on ourselves. Why, if I am feeling a certain type of way, why, and then maybe I might not be the best person for that loved one to talk to until I'm able to maybe address some of my reasonings. So we could still continue a great relationship. However, maybe that particular subject is good to discuss with other professionals or other loved ones.
Mhm.
Yeah, I love that advice. It's very, because yeah, it is difficult sometimes. When you're so involved with someone or someone so much, and
Yeah.
it could get the conversations could get difficult for sure.
Yeah. Yeah. And of course, it's always harder when someone's close to you. So it's like we can also take that as medicine in some way, where like we can kind of take stock and understand like, okay, where can I do work on myself to help be present and understand again, like when to step in and when to step out.
Well, that's good. I think I got a really good idea of the differences. Some tips and uh, and ways that we can kind of help each other in dealing with our anxiety and panic attacks. Any other like last minute like advice, tips, suggestions, highlights you would want to give?
Sure. I mean, the first thing, and this is just, I don't know if this is just me as a clinician and this is my style, but sleep is so important. Sleep is so, so, so important. And so I think when we lead busy lives, sleep very easily can fall to the wayside, especially depending on your personality. Like some people are happy to get in bed at 9 p.m. every night, and that's like their happy place and they know how to sleep good. But for many, it's even just for reasons beyond their control, they're not getting high quality sleep and they're not getting enough sleep. And so I think sleep is so important. And that kind of branches off to include like a good sleep hygiene, and also looking at substances because substances can exacerbate. And I think for anxiety in particular, or like sometimes in like a different, like a more bipolar presentation, there's like this angsty, like irritability internally. It can be easy to turn to a substance to kind of quell that in the moment, but then it can disrupt and cause rebound anxiety. So it means like after the substance is out of your system, it kind of like overshoots your nervous system. So just being aware of like what we're putting into our bodies and our minds. um, Yeah, so taking care of the body, right? Making sure you're eating, well, for the most part, sleeping and exercising. Um, it's at least a foundation. And then if something else happens out of your control, you have something you can go back to. And then supports, people that you trust that you can talk to. Um, I would say those things are pretty key, at least for, again, foundation and some prevention of anxiety.
Awesome, awesome, Erin. Any questions for me? I don't know much of these answers, but if you have any questions, I'll take them.
I don't know if I have any I mean, how, I guess I'm curious to know, like, as from a non-clinical perspective, like, what have you seen with, like, anxiety maybe in people in your life, or just, like, how you kinda see it show up in society?
Yeah, I feel for myself personally, I feel like and it's definitely warranted, the amount of people getting anxiety and dealing with it. But I feel like sometimes people are too involved in non-important things. And not to say
Mm.
non-important, but I feel that I think you just have to order your life, put some perspective as to what's important, what's not important. You're not your job, you are not your hobbies, you are not, your test grades, you are not none of that. So disconnect as much from the outside noise and understand that in a hopefully, a long life that we're all able to live, it's gonna be ups, downs, changes, situations. A lot of those situations change, but we remain the same. So always keep yourself into account and don't put extra pressures on yourself as much as possible. Like, and I know it's difficult. That's easier said than done, because I've experienced it myself. But that's one thing I always keep in the back of my head. Like, I'm just myself, and I just gotta try my best for today, and not worry how everything else ties in. So that's one piece of advice I would give.
I like that. That's a good philosophy to live by. And it's true because we can get really wrapped up in what we do. Like, and the result of what we do can go great and could go poorly. And if that's what indicates how we feel, then yeah, it's gonna be a roller coaster ride.
Yeah, well, I know I feel a lot better after this discussion. Hopefully, all the listeners do. And we'll see you guys in our next episode. Thank you for watching Beyond the Therapy Session.
All right, thank you, George.